New at 11, a 9 on your side I-Team investigation. After several leadership changes and more than a dozen internal and external reviews, the Cincinnati Veterans Medical Center's spending habits now in question as a whistleblower points out that the VA spent nearly $8 million on robots to perform an average of 55 surgeries a year.
We purchased $2 million worth of equipment, but to save money, we didn't get the maintenance contract.
Mike Brooks is a whistleblower who sounded the alarm on the Cincinnati VA Medical Center's spending of $7.6 million on 4 surgery robots since 2009. It wasn't just the purchase. There was also that maintenance contract the VA didn't buy, the one to repair and replace anything if something went wrong, which it did in June of last year.
Unfortunately, one of the arms of one of the robots is broken at this time, and it's sitting in the hallway. Unusable.
While they still had one robot in operation, 9 on your side discovered the broken one sat idle, not performing operations for more than a year. Since the interview with Brooks last December, the VA spent more than $2.6 million to repair the broken robot, trade it in for a new one, and add a maintenance contract. Vivian Hudson is the Cincinnati VA Medical Center's 3rd director since 2015 and had this response when asked about the money spent and decisions made by past administrations.
And only trust that they have the best intention at heart, wanting to provide high quality, cutting edge technology in our hospital.
But was the nearly $8 million well spent? On average, the robots only performed 55 surgeries per year. When you compare their average to the average by other Da Vinci users, there's a drastic difference.
From the numbers, might probably be limited to how many veterans need this. So
Dr. Kirsch Gatande is the chief of urology at the Cincinnati VA Medical Center.
Did you have questions at all when you had multiple machines and everything was going on?
I think I looked at it from the clinical perspective, and we were expanding the program at that time.
An expansion many say was a necessity for care and competition.
It would make it hard for us to attract young, talented physicians without having a robot.
Dr. Elizabeth Brill is the newly hired chief of staff and says they're already reviewing future spending.
It's a good point that we do need to pay attention to the costs, and I think we need to be critical every time we make a decision about a large piece of equipment that we're spending our money wisely.
Now, the issue of the robots also raises concerns during the same time frame when manpower issues, according to some, impacted the overall care of our veterans. My colleague Dan Bonk expands on that and why the VA could be losing money from operating in this manner. His full report is on WCPO.com right now.